At the very start of the first pandemic wave in Europe, we had very few knowledge on the disease and especially on the rate of bacterial co-infection and super infections. So this led clinicians to prescribe antibiotics in almost all patients with COVID-19 admitted to hospital. Additionally, we faced a diversion of antimicrobial stewardship resources, namely ID physicians who were focused on the COVID response. And so stewardship activities were severely impacted, for example, for education and training of prescribers, with deep consequences on the appropriateness of antimicrobial use. And finally, the hypothesis that specific antimicrobials like azithromycin may have a positive impact on the COVID patients, which actually was supported by certain French teams, led to a major increase of the use of this specific antibiotic. In order, to keep delivering very simple messages, just stick to the basics, even in the context of an emerging disease. Use microbiology sampling to guide antibiotic use, prescribe antibiotics only when necessary, and if you do so, use short durations. Concerning IPC measures, infection prevention and control measures, it would have been very useful to have an homogeneity in the recommendations to maybe question earlier the systematic use of gloves for what is basically a respiratory infection, focus on very essential preventive measures, for example, universal masking in all circumstances for both healthcare workers and patients, eye protections for workers too, and simply ventilate rooms by opening the windows where possible. In the last 2 years, prevention of infection has received an unprecedented global attention from healthcare workers and the general public. So I think now it is crucial to seize this unique opportunity to mobilize on prevention of infections in general and on antimicrobial resistance, which is actually another upcoming pandemic. Since reduction of infections has a direct impact on AMR, we should promote education of the public on the general prevention of infections, like with hand hygiene, vaccination, mask wearing when symptomatic. And in hospital, maybe we should also consider mask wearing as a universal protective measure, especially during the winter season.